This is Dr. David Green. The topic today is prescription pain creams for plantar fasciitis. Plantar fasciitis is a painful foot condition that refers to inflammation of the tissue that extends from the heel along the arch of the foot. Okay? It's very common in those who are runners who've also potentially gained a lot of weight rapidly, athletes, and simply middle-aged individuals. A lot of times people present and they have no idea what they did for the condition to come on. It's just very common. Millions of individuals suffer from it. Symptoms may include pain localized along the heel and at the bottom area of the foot. The pain is often severe, especially when patients first stand up in the morning. It may subside quickly, but then return after prolonged standing or walking. Current treatment options include such things as rest, ice, stretching, shoe inserts, night splints, such as you see here, cortisone injections. You've got to be very careful with how many you do. You can get fat atrophy with those. Shockwave therapy, such as this, can help, and then oral or topical medications. Prescription pain creams have been great for plantar fasciitis. They offer direct pain relief with the medication getting absorbed right through the skin. There's a trifecta of benefits. There's no bloodstream absorption, so you don't have drug interactions with the medications you're already taking. There's no liver or kidney side effects. All the ingredients in the creams are FDA approved, and it's really amazing that the relief that can be found. Much stronger than anything you can find over the counter, and they are odor-free. A large survey was done last year on about 4,000 patients that showed that 83% of those using prescription pain creams achieved excellent results for all types of pain conditions such as fasciitis. 38% of patients were able to decrease the amount of pain medications being taken by mouth, and the average amount of pain reduction was equal to 57%. If you have private insurance with prescription benefits, you are a candidate to receive the creams by mail. This may involve a telemedicine doctor consultation, which we'll set up for you with a licensed provider in your state. You can get that done immediately, or we can send a prescription to your PCP, whichever is more convenient. Each patient receives a personal advocate and access to a licensed pharmacist. All the ingredients, once again, are FDA approved, and the prescriptions are shipped right to the patient's home at no additional charge. Your pain stops here.